Joining me now from Geneva is World Health Organization spokesperson Tarik Jasarevic. Thank you so much for joining us here on the program. Now, in some parts of the world, like in the UK and US, we're seeing more and more restrictions lifted, while in other parts of the world, governments are tightening measures against COVID. How is the World Health Organization mediating the decisions that countries are making when it comes to this particular issue? Because working collectively surely would bring the world a step closer to officially declaring this pandemic an endemic.
Countries are looking into best ways really to reconcile public health measures and trying to reduce the transmission, and at the same time trying to not go into lockdowns and shutting down societies, and it's perfectly understandable. Then the situation is different in different countries, so we cannot have a blanket recommendations. It really depends on a national context. Even within countries, situation may be different in terms of epidemiology, in terms of vaccine coverage. It means in terms of vaccine uptake, testing availability, and health system situation. So we understand that countries may have a different approach. What is really important for all countries is really try to see how we can get out of this acute phase of pandemic. And to achieve that, we need also global solidarity and global cooperation that you mentioned. We need to try to get 70% of population in every country being vaccinated by the mid of this year, which is the WHO goal. We need really also to help strengthen health system everywhere, make sure that health systems have what they need. We need to boost also testing, diagnostics, that we have these tools at our hand and that are distributed equally around the world. So there are a number of things we can do to get out of the acute phase of pandemic.
Right, and that brings me to my next question. You mentioned vaccines being distributed to all parts of the world and that we need a 70% vaccination rate to overcome this pandemic. But unfortunately, that's not the case. We're seeing many developing countries not being able to get enough vials to vaccinate most of their population, even if they wanted to. What is the World Health Organization doing on this front to make sure that these developing countries do indeed have access to the vials they need to overcome the pandemic in their own countries?
Well, it's true that we have right now 34 countries in the world who have vaccinated less than 10% of the population. 85 countries have vaccinated less than 40% of population. And there's 1 billion people in Africa who have not seen the first dose yet. WHO is part of a COVAX mechanism that is accelerating delivering vaccines around the world. And we have seen that there are more vaccines now being shipped to low-income countries. And we hope that this trend will continue. We are asking manufacturers to prioritize deliveries to COVAX. We are asking also to developed countries to prioritize global sharing of vaccines, because we need this global coverage, vaccine coverage, in order to not let the space to virus to mutate and come again in another variant that may be even more fit to avoid vaccine antibodies that we are putting into people's bodies.
And I understand that the World Health Organization is also struggling with funding at the moment. What has caused cuts in funding, and how is this affecting your organization's operations?
Well, right now we are having executive board discussions here in Geneva, where member states are discussing sustainable financing. We have seen, and this pandemic has shown that the world is not ready. We are not ready at the national level, but also at international level. We need to invest more in a pandemic preparedness. We hope that these discussions among member states will lead to increased and more predictable financing on international level, so we can put in place measures that will help us to have a more predictable response and more robust response next time we face a situation like this.
All right, Tarik Jasarevic, thank you so much for joining us here on the NewsHour and giving us your time.